Has now been nearly a century since Theodore Roosevelt first called for health care reform. And ever since, nearly every president and Congress, whether Democrat or Republican, has attempted to meet this challenge in some way.
The debate for universal health care has come up from time to time in America's history, each time being met by heavy opposition and ultimately rejection.
One of the traditional methods of imposing statism or socialism on a people has been by way of medicine.
The Constitution of the United States did not make the President or the Congress powerless. It gave them definite responsibilities to advance the general welfare.
On December 24, 2009, members of Congress and those part of the large pharmaceutical groups got together and composed a health care bill in excess of 2,000 pages. While this was a dream come true for many Americans, others saw it as a threat to their individual freedom and right to choose.
This morning, this vote in the United States Senate lit a candle of hope for 50 million Americans who went to bed last night without the protection of health insurance.
The reason you should have choices in your health care is because we own our bodies.
After the death of Senator Ted Kennedy, Republican candidate and now Senator Scott Brown was elected to the seat, a position once thought to be a Democratic stronghold.
In the United States Senate, you've got to have 60 votes for everything. After the special election in Massachusetts, we now only have 59.
People should have insurance, not just this particular bill, because it's not good for the entire country.
We will break the old gridlock and guarantee that every American, north, south, east, west, young, old, will have decent, quality health care as a fundamental right and not a privilege.
It is unclear whether the bill will pass in its current state, but one thing is certain. The matter is being addressed and the Houses will decide the fate of health care.